My name's Jackie Green. I'm the current chair of the Disability Forum for the National Executive Committee. I'm also one of the national vice presidents and group vice president this year for the Ministry of Justice. I'd like to welcome you all for attending, because I know that it's late in the day. You've probably all been working and you're feeling a bit tired, and you know, there are other things that you might want to be doing, but we're grateful that you're here because we understand that you must have an interest in this. And we've got a celebrity selection of guests. We've got Nikki Mckay, Andy Boylan and Austin Haney. And my internet connection, a little bit like me, is unstable. So hopefully we'll still manage. Nikki, sorry, if you try to use the chat at the moment, you'll find it's disabled. That's simply because we want you to be able to focus on what the speakers are saying. And then when we've heard from all three speakers, we'll have a question and answer session. We'll have a short break and then a question and answer session. So you'll be able to type in any questions you might have, but don't worry, because we've already got some questions from earlier in the day, from the seminar we ran earlier in the day. Richard will be translating for those who need the interpreter skills. Okay, so I've got to remember to try to speak slowly and clearly, because we want Richard's hands to remain after the end of the session and they're not aching. Okay, we've got live captions. So if you go to the bottom of the screen, you'll see a button that you can press if you want live captions. Okay, and then there is this performance. If you want to pin somebody, you click on the video that you particularly want on your screen and you can pin them so that you can just look at that person and admire them. I wouldn't suggest you do it to me because I'm not looking my best today. Okay, so the first person who will be getting nervous because I'm jabbering on is Nikki. And Nikki is going to talk about what we know as reasonable adjustments. So welcome, Nikki. And I'm sure everybody will be interested to hear what you have to say, Nikki. Thank you.
Thank you, Jackie. Right, I'm Nikki Mckay. My background is in HR, working across disability. I also have a psychology and sociology degree. I've had disabilities myself since 1989. I'll be talking to you today briefly about the legislation and disability, including and focusing on reasonable adjustments. And just to remind everybody, as Jackie's just said, if you have any questions, can we please keep them to the Q&A, please? I've also provided a resource pack of elements that I'll be talking about during this session for everyone. It's important to understand disability legislation is not new. Early legislation was in 1944, supporting people returning from the Second World War, and as a reaction to mass killings of disabled people, as well as pre-war eugenics theories that disabled people should be sterilised. Current legislation, the Equality Act 2010, which combined previous equality legislation and replaced the DDA, the Disability Discrimination Act, is not specific to the workplace, but covers the provision of goods and services, how people should be treated equally in society. Disability is one of 9 protected characteristics. We've all got protected characteristics, and the Equality Act protects people from 4 types of discrimination, with an additional 2 for disability: discrimination by association, which can cover those with caring responsibilities, and failure to make reasonable adjustments. ACAS state that failure to make reasonable adjustments is the most common form of disability discrimination, and you are only entitled to reasonable adjustments if you yourself have a disability or disabilities. Despite legislation, disabled employees are the most disadvantaged group in employment, less likely to be in employment in the first place, and with the biggest pay gap reported by the TUC in 2019. A discrimination report done by Lead Aid Solicitors in 2014 commented that a reason for poorer pay might be that disabled staff are more likely to work part-time. But with ACAS stating failures to make reasonable adjustments is the most common form of disability discrimination, that could also be a huge issue. Employers know that often disabled people don't disclose disability, possibly because of fear of discrimination. And research shows disabled people tend to minimize the impact of their disabilities. Often people may not want to label themselves as disabled. Another issue might be that with so-called hidden disabilities, there is a fear that people won't be believed when they talk about these issues. It can be humiliating talking about disability, and disabilities can worsen. You're more likely to be disabled if you're older, have a working class background, or if you are female. People tend to try to cope without asking for help, but this soaks up energy, leaving people exhausted. But also people may not recognize they have a disability. Research in the last couple of years showed that when given the legal definition of disability, people recognize they had mental health disabilities. So it's really important to know what constitutes disability. The Equality Act definition states you have a disability if you have a physical or mental impairment which has a significant and long-term adverse impact on your ability to do normal daily activities. That might be making a cup of tea, carrying shopping, or just hearing a doorbell. Substantial is defined as more than minor, and long-term is defined as a year or likely to last a year or the rest of someone's life. It doesn't matter if an impairment comes and goes, or if you have treatment which helps you manage. The Act covers chronic conditions and considers the effect of impairments without treatment. It's vital to understand that a health condition is not necessarily a disability. It has to meet all of the definition. And some symptoms which aren't health conditions, like the effect of the menopause, can be disabling. But some health conditions are covered from diagnosis, like cancer, whereas other health conditions are specifically excluded, like hay fever. Ultimately, a decision about whether someone is disabled or not is a legal definition and will be down to a tribunal to decide, although occupational health can advise. A key pillar of the protection disabled people have under the Equality Act is the right to reasonable adjustments. Reasonable adjustments are preferential treatment. Disability is the only protected characteristic which allows, and in some cases requires, preferential treatment. It's really important to distinguish between workplace adjustments and reasonable adjustments. Reasonable adjustments must be made if requested by a person with disability. And again, many people with disabilities don't know of the legal definition of reasonable adjustments. The Equality Act definition of reasonable adjustments is that they must mitigate or remove the effect of the disability. They must be practical to make. They must be affordable given the resources of the organisation, and they must not impact on the health and safety of others. Reasonable adjustments apply to the workplace, the journey to work, the job you might be doing, as well as the recruitment process. Quite often disabled people know they need reasonable adjustments, but don't know what they need. And line managers might not know what would help either. Another huge disadvantage can be the view that adjustments should cost nothing or very little. An investment of a few thousands of pounds can be cost effective in keeping a disabled person in employment for decades. So what do I advise? Firstly, do talk to your line manager. Set out, think about how you're going to start the conversation. Think about what points you want to get over and what you want to get out of the conversation. Complete a workplace adjustments passport stating what your disability symptoms are. Even if you haven't got a diagnosis, showing you've notified your department of your disability symptoms is really important. Set out what adjustments would help you. You can ask for adjustments to be put in place urgently on a temporary basis whilst your department is getting more information. You can ask GPs or consultants to provide letters supporting your need and refer to adjustments in the correct legal format as reasonable adjustments. But be aware that many health and safety staff do not know the definition of reasonable. More about the workplace adjustments passport from my colleague Austin in a couple of moments. Secondly, do go for an occupational health report. Make sure you write on the referral that you want to see any report before it goes to your employer to correct any errors. and you want to give written consent to release the report. Bear in mind, a poor report could be worse than none. If you still have access to work, use that route. Thirdly, don't try and save money for your organisation. I know of one person who did not want her organisation to spend £2,000 on a desk for her. That is easily affordable. And if it stops pain or health deterioration, it is more than worth it. Fourthly, don't waste a lot of time. If your adjustments are not made within a couple of months, make sure your PCS branch chair is aware and consider writing to your permanent secretary and your disability minister. We all have them within civil service departments about the issues you are facing. These senior staff can often cut through issues. And bear in mind that for you to realise your full potential, you will need to access the support you're entitled to. I hope you find this interesting and helpful. I wish you all every success in your careers. Thank you very much.
Thanks, Nikki. I'm sorry, I did you a disservice because I raced in panicking because it said internet unstable. And so I didn't introduce you properly, but Nikki, as she said, works in HR, and you've created Learning for Line Managers, haven't you, Nikki, on disability and reasonable adjustments. So she's somebody who knows, she's not just talking about it, she actually knows it. And you became a trade union rep, I think in 2021, so quite fresh to the role, which is good as well. And you have a particular expertise on disability, and because you've been doing your own research on joint pains. So sorry that I didn't give you an introduction in the beginning, Nikki. It was just because I saw the internet flash up and thought, God, I better get her on, and then I can panic about it. So thanks, Nikki, for that. And the next person we're going to hear from is Andy Boylan. Now, Andy, I won't forget to give you an introduction. You work for the Ministry of Defence. So we all know about the Ministry of Defence, and it's not all about guns and tanks. You're a lead PCS rep, and you're also the Equality Chair for the Ministry of Justice Civil Service Unions. And you're the Disability Lead in Ministry of Defence for PCS. And like Nikki and Austin, you're a long-standing and valued member of the National Disabled Members Forum. And before anybody goes back and says, Jackie Green said those three were long-standing and valued, everybody on that committee is valued. Okay, but it's these three particularly today that I'm valuing the most because they've given up their time. Okay, Andy.
Thanks, Jackie. I'll just say that I'm the Chair for Equalities for the Ministry of Defence, not the Ministry of Justice. And I'll also have to say that I'm looking at the subject of access to work through the lens of the ministerial departments. So apologies to those of you from other employer groups. So what is access to work? Well, the gov.uk website says access to work can help you get or stay in work if you have a physical or mental health condition or disability. The support you will get will depend on your needs. Through access to work, you can apply for a grant to help, pay for practical support with your work, advice about managing your mental health at work, and money to pay for communication support at job interviews. Now, admittedly, there was always an inconsistent process applied to the civil service. DWP, in general terms, couldn't use access to work, nor could Westminster-based civil service buildings. What this meant from a Ministry of Defence point of view was that main building, our Westminster headquarters, couldn't use access to work, while the rest of the MOD civil servants could access the service. Access to work would not supply normal office equipment, so MOD still bought special desks and chairs, for instance, but I've known them provide more non-standard equipment with MOD paying a proportion. For example, I've known them buy electric wheelchairs to use in the office for wheelchair users that can only afford manual chairs privately. They also give grants for accessibility help, be that taxis to and from the workplace, or in the case of a very good friend of mine, to purchase British Sign Language support in meetings. In 2020, there was a Cabinet Office missive that decided that ministerial government departments would be prevented from using Access to Work. And that decision will come into force in April 2022. Anyone with a pre-existing grant from before that date will be supported until the grant review point. Mental health services will still be accessible. Now, in the MOD, I've been shouting from the rooftops, as it were. We needed to get policy in line to have the department be able to take up the slack, and I think more importantly, get budgets in line. Unfortunately, MOD seemed content to kick the issue into the long grass. Now, problem number one, as I saw it, was just how much Access to Work grants are given to the MOD civil servants. The answer, worryingly, was, we don't know. I even tried a Freedom of Information request to DWP for the figures, but it was refused on the ground that employer records are not kept. The head of civilian personnel in Defence Business Services told me that his people had done rough calculations, and it could be anywhere between £4 and £10 million per year. And that money going forward has not been budgeted for in the MOD. And the long grass has soon come upon us. And MOD now have a working party to look at the issue. On a plus side, PTS are embedded in that working party. But there is the funding issue I've mentioned. There's finance policy. There's policy guidance for consistent decisions. And there are many, many other things that this working party has to consider before the 1st of April. Now, I fear, and I think it's a well-founded fear, that we'll not be in the shape as a department to give disabled employees a seamless transition come April 2022. And I suspect that will be the same in other departments. So make no mistake, this is an issue that I believe should be on every ministerial department, GEC and national branches bargaining agenda. And in MOD, I will say that this was part of our group conference, and we have conference policy on trying to get this right for our disabled members. It's right, I think, that if they can, equality leads in the various departments should try and work with the department to get the pieces in place for April. Beyond the fact that it's the right thing to do for disabled members and staff, it's something that we can use as a recruitment piece, if the new systems work, that is. We can go out to disabled members and non-members and say that we've been involved, that we're looking to hold the employer's feet to the fire, and that the union is adding value for their working lives. But also, we need to say that should this fail, should the removal of Access to Work mean that a person looking for reasonable adjustments is treated less favourably than employees who were there when Access to Work was available, or that an existing Access to Work user loses their reasonable adjustment, then they must come straight to the branch reps. The line I've recommended to the defence sector GEC is that we need to be aggressive in these cases. We need to push towards ACAS, pending tribunals, whilst we're lodging grievances. In a department like the MOD, and Nikki mentioned in her piece about cost being considered reasonable to what the employer spends, we're spending billions on a weapon system. And so there can be no good argument to say that an adjustment that had been provided by Access to Work is no longer reasonable when the employer has to pay for it. or for all of it. But I'm already hearing worrying things. One person reported that their line manager had said to them that after access to work ends, MOD would not provide a wheelchair as DWP had done previously. That's been reported to the centre, but it shows that the local managers, with their own budget pressures and no additional money bid for, will try and avoid providing adjustments. But these are cases we can and we must win. I've asked through the NDMF for the groups, once they've got provisions in place and they've been agreed, to put in best practice to the other groups through the National Disabled Members Forum. And through that forum, I'll be asking PCS nationally to put out information and advice to groups and branches facing this issue. Now, I do realise that some at this call will be from areas that still have access to the scheme. And so to you, I say thank you for your indulgence as I've gone over this issue. And of course, I'll be happy to try and answer any questions at the end of the seminar session.
Thanks, Andy. And then just before I bring Austin in, I'll explain to you that when Austin finishes, the lines will go live, in that chat will be back up, and we'll have a break and you can type any questions that you might have. But don't worry, because like I said before, we do have some questions from our earlier sessions, and they might help you think about what kind of questions you want to ask. But it would be really great if you had questions, if you typed them in, and then I can read them out to the panel. And they don't know which question they're going to be getting, so it's a bit like roulette. So they're all anxious, waiting to see if the ball stops with them, and then they've got to answer the question. So they're all really knowledgeable, and I feel perfectly safe in just handpicking one of them and then another one of them. So if you do have questions, make sure that you put them in the chat when we go into the break. So last but by no means least, Austin Harney, who'll be covering workplace adjustment passports. Austin, I don't really need a biography for Austin. I feel like we've been friends forever. Austin does an incredible amount of work. He's on the Ministry of Justice GEC. He's a local branch rep. He is a member of the NEC and a member of the TUC. So Austin's got loads of hats that he wears, but he's very hardworking and he is a good friend of mine. So welcome, Austin, and you're going to be talking about workplace adjustment passports.
Thank you very much for your kind words, Jackie. So I'm glad I'm not the least person here, but very good speeches from Nikki and Andy, I want to say as well. Just as I begin to talk about the disability passport, I'll start with the definition. It's a live record of adjustments agreed between you and your manager in order to support you at work because of a health condition, impairment, or disability. It's also for you to keep and pass on to any future manager, employer, or anybody who needs to know the barriers such as attitudes and environmental factors that impact on one's health condition, impairment, or disability. The document is confidential and will require your consent to be shared with the relevant person or authority. As I talk about its purpose, we'll make sure that everyone is clear and has a record of what adjustments have been agreed. Also to reduce the need to reassess adjustments every time you change jobs, are relocated or assigned to a new manager. You also need to provide you and your manager with the basis for future conversations about adjustments. So really, it's there to save you also the stress if you wanted to apply for a new job, particularly in the government department or in the civil service. You don't have to go through the whole procedure of occupational health referrals, meeting with new HR advisors or managers, having to explain everything all over again. That document will travel with you and that will cover everything for you on your first day. So that will save a lot of people's stress. It's also an agreed document because, you know, there's an old saying, promises are promises, but the manager has to stick with those promises of reasonable adjustments as well, which is recorded in that live document. Just as I talk about its functions, it's to be reviewed regularly, at least every 6 months or sooner, if there is any change to your job or condition, if the adjustments are still appropriate and effective. Your manager may need to have additional advice from occupational health, access to work, or HR before any adjustments can be agreed, but should not be subject to any delay. You're entitled to seek regular advice from your trade union representative, who can accompany you to any meetings in order to discuss adjustments. So that's important, help and assistance from the trade union representative, because there's a danger of only hearing a distorted version, maybe from management or HR. So it's important that one is informed of one's rights. Lastly, ensure a review date of adjustments if necessary and inform your manager. I'll just read out the Statutory Code of Practice guidance from the Equality Human Rights Commission. In order to avoid discrimination, it would be sensible for employers not to make a fine adjustment as to whether a particular individual falls within the statutory definition of disability, but to focus instead on meeting the needs of each worker. So in other words, nobody at work or a manager has a right to make a judgment of one's disability. It's more about agreeing the reasonable adjustments that are required for one to perform comfortably in their role or job. Right, why do we need reasonable adjustment workplace passports, particularly in the workplace? Well, first of all, disabled people still face significant barriers to getting a job and staying in employment. Secondly, the disability employment gap between non-disabled and disabled people continues to persist, over 30%. Disabled people within the job market are paid on average 16.5% or £3,458 a year, and that is £1.90 per hour less than the non-disabled peers. And we're talking about a 35-hour week. So any increase of hours, that gap will be bigger. Disabled people are twice as likely to fall out of work as non-disabled people. 1 in 10 disabled people leave work. Over half of reps have dealt with disability-related issues between 2014 and 2016, revealing the high prevalence of disability-related workplace issues. Disabled members are often forced to re-explain and frequently negotiate their reasonable adjustments when their line manager changes or moving roles, causing unnecessary stress, as I've just explained before. Also, the fact is, during the pandemic, this situation is becoming exacerbated. So 2 out of 5 disabled workers are facing enormous economic and financial hardship with the COVID-19 pandemic. Also, the fact is, we and the Disabled People's Committee, the Disabled Members Forum, it's important to know that we just, I'm autistic, that's my background, by the way. I was diagnosed with autism at the age of 4. I was even sacked from the civil service a long time ago, and that was before the Disability Discrimination Act became law in 1995. There were no reasonable adjustments in the day when I was dismissed. But I think, we've just come a long way, and it's important that we ensure better treatment of employment for disabled people at work. And I see that the disabled workers passport, the disability passport is very crucial, very vital for all of us. Unfortunately, there are many managers who have not really heard of this. There are many PCS members who have not heard of it, but I think it's important that we always take it forward in personal cases when we represent each disabled member when they're facing difficult times. I also want to mention the fact that we, the Disabled Members Forum, we actually represent people throughout the regions. Now, this is important too, because over 53% of people in England, disabled people in England, are in employment, but that's not the same throughout the rest of Britain. In Scotland, it's only just over 46%. In Wales, it's higher, it's over 48%. But in Northern Ireland, they have the lowest rate of disabled people in the United Kingdom, which is only about 38%. And even worse, there are PCS members who live in the Republic of Ireland who have to travel to work in Northern Ireland itself, and have far worse disability legislation in their own country. So, they're not really well aware of their rights in the workplace as such. But I think it's important that, on the whole, we explain the issue of the disability workplace passport to each of our members when they're facing difficulties. So that's really what I wanted to conclude. I'm more than happy to take questions from the floor.
That's excellent, Austin. And we've been spoilt this session because people have, thank you very much, sent some questions. And once I get rid of the ones that are welcoming everybody, I'll go down to the questions. Okay. And the first one is from Mandy. How does a request to work permanently at home fit in with reasonable adjustments due to disability in civil service? So in no particular order, but I hope you're all back. I'm going to ask Andy to answer that one.
Thanks, Mandy. Well, I mean, the simple answer is that a request to work permanently from home could be a reasonable adjustment, and it would very much depend on the role you're in or another role you could be in. So it could be a role change as a reasonable adjustment to enable that. I think what you need to consider prior to a request, and it would be not impossible for the employers to argue it's not reasonable, but difficult given the pandemic and the fact that many of us have been working from home. What you would need to consider is your employer's own policies on home working. So from a Ministry of Defence point of view, whilst we were office workers working at home, we didn't come under the home working policy. And in MOD, that is quite security tight. We have to have a room that we can give up in the house. The door has to be lockable. There's new lines put in, and it's a security issue. It's not beyond wit and wisdom, but for the employer to do it. But the person who's giving up the room, that's something you have to understand. Of course, not all employers are as security heavy as MOD is. The other thing you will have to think about is that it does have implications on things like tax. So if you were to sell your house and you're a home worker, there is an impact on the capital gains tax. But going back to the substantive question, it can be asked for as a reasonable adjustment. And as in all these things, it's then for the employer to explain, if they say no, why they believe it's unreasonable. And ultimately, if there's a disagreement, go to PCS. The reps would run the case for you, and potentially there might be a tribunal, because only a tribunal can actually say if an adjustment is reasonable or not.
Okay, thank you, Andy. And then we're in sport tonight with questions, actually. Well done, those of you who are sending your questions in. So the next one, they're coming in so fast I'm losing them. I work in HMRC training. I work in HMRC. Training in general is very poor. Lost the question, where's it gone? Let me just look at it somewhere else, sorry. I work in HMRC. Training in general is very poor. Many managers may struggle or make poor decisions in relation to disabled staff. Poor understanding of health and safety and equality legislation and skewed interpretation of HR policies. Should we be asking PCS to campaign for better managerial training in equalities and health and safety? Nikki.
Thank you, Jackie. I was really hoping and praying you'd give me that one. This is going to sound really radical, but no. When you look at the number of civil servants in the civil service, we're talking about 450,000 people. If we are talking about training all line managers, huge numbers of that 450,000 are going to be line managers. And we give them a one-shot training session, and they might not have a disabled person to manage for years, by which time they've forgotten all about it. Plus, each individual manager have got their own biases, prejudices that they bring to the table. What has been talked about in HR circles is actually having the line manager as the first approach that you would make. But then for reasonable adjustments, it goes through to a specialist team. And I honestly feel that is the way forward, that we have a specialist team in HR that understand health and safety legislation, that understand reasonable adjustments, that understand the law. And those are the people, we have a proper process that's audited. So you make an application to that team, it's written down, it's there in black and white, in writing. It goes through to the team. Any decision that they make is there in writing. And I honestly feel what we should be doing in PCS is actually saying, look, it is not reasonable to expect to train hundreds of thousands of managers in disability when we know each disability is different. Even if you've got two people with the same disability, it manifests itself in very different ways. What we really need is a really tight, focused group in each department that will make those decisions and will take it off line managers and will actually have the funding as well to put adjustments in place. So that's my personal view. But I do think that PCS have a real job on their hands in pushing forward better working conditions for people with disabilities.
Okay, thank you, Nikki. And Sam and Lynn have written and given some further information on the question. So if you want to take the time to read those, but we've got another question, and it's one of those it's from Sam, and I like it because it starts, she's asking for a friend, or he's asking for a friend. A friend is asking if PCS has any thoughts on an ideal form of words when putting in an occupational health request. Austin.
An ideal form of words? Well, I think first of all, people need to be aware of language, particularly for disabled people when they're putting in for referrals, how they're treated with respect. But also, I think we can't really depend so much on OHS specialists. I think people, when they are applying for OHS referrals and you're asking for a form of words, well, first of all, people have the right to go and see their general practitioner, disclose their personal medical records. That's if the member is happy to do so. But also, more to the point, is that when those personal confidential medical records are disclosed to the OHS specialist, they're done in the strictest confidence. That the OHS specialist has a very clear and concise picture and is able to put in, proper recommendations for management to follow. The fact of the matter is we talk about a form of words, but we're going to be honest with ourselves. There are so many OHS specialists who are appalling, inexperienced. I, as a trade union representative in the past, have actually sat in OHS referrals, and on some occasions have actually asked for a fresh occupational health referral when they're not carried out properly or correctly and don't really understand the real meaning of disability legislation, or don't really understand the disabled members' needs. So what I'm saying is, by actually going to the trade union representative, and I think this is what all disabled members must do, that they should confide in their trade union representative who would have experience of disability discrimination, and make sure that all the correct procedures are followed with occupational health referrals, never mind line management. So you're absolutely correct. There needs to be a form of words, but I think, it's having to get that off the ground. And I think it's about watching the OHS specialist and making sure that disabled member, gets the proper service and better treatment that they deserve.
Okay, I'm just going to check with Nikki, because from your HR perspective, do you have anything to add about sets of words?
I think we have specialists in PCS, we have specialists that will help you write up a referral. But the form of wording should be that this is the disadvantage posed by my disability, and I want advice on reasonable adjustments that would help mitigate the disadvantage. So I would say, speak to your PCS reps, find out, has anybody got a form of wording? But very definitely, when you go into an OH situation, as Austin said, I've had really bad experiences with occupational health. And I think at the absolute minimum, you can ask to take somebody in with you. You can ask to take a union rep in with you if you feel that you wouldn't be able to get your message over without that support. And just try and focus on what you want to get out of it. So think about what you want to get out of it when you are helping write that OHS referral.
Okay, thanks. And so I'm going now to some questions that we've had earlier, and it's a testing time for the panel because I'll be listening to see if you give the same answer again. Okay. So this one is for you, Andy. What is the best way to request reasonable adjustments at work? And that's from Mandy Christie of the Department of Works and Pensions.
On the exam part of this, Jackie, I think this is dead easy because I can give a different answer, because there are many different ways, and it depends on your employer and your employer's policies. So I'll give it from an MOD point of view. Either in the MOD, on the HR system, you can tick a button that says, I have a disability and I need help, and it will contact your line manager for you, or one would hope that you have a relationship with your line manager, and in the first point of contact would be the line manager, and to say to the line manager, I have an impairment or a medical condition, however you want to phrase it, and I think I need adjustments within the workplace. As Nikki's just said, talk about the disadvantage of that. And from the PCS point of view, Jackie, I think it's important to say the way we look at this is under the social model of disability. So it's not your condition that's the disability, it's the barriers that, in this case, the employer puts before you, so that prevents you from being able to fully participate in the work experience, as it were. So talking to your line manager, if you're unsure, if you're worried, talk to your union rep. And in the MOD and in other departments, I'm sure have similar, we actually have a reasonable adjustment support team, which any line manager or member of staff can approach for help and advice.
Okay, thanks. And going back to occupational health reports, there's just an add-on. How would you challenge a poor occupational health report? Well, I think that lots of the reps regularly challenge occupational health reports, because somebody I think mentioned in the chat that it can be subject to interpretation. But I'll just bring Nikki back in for a brief response.
Thank you, Jackie. In the HR capacity, I've read occupational health reports that just don't make sense. And quite often, the doctor, the medic will write stuff down and not actually consider how different parts of the report hang together. What we can do in HR is we can get in touch with the organisation and say, look, we need to talk through this report, because you're saying this in one place and you're contradicting yourself in another. As a member of staff, you don't have that opportunity. But what you can do is make sure on the referral that you say you want to see the report in writing, and you want to be able to give written consent before that report is released. And you will then see the OH report. You should be able to go back to the OH organisation, health management, OH assist, whatever, and say to them, can you please amend this report for accuracy? And just say, this is not accurate, that's not accurate. Ultimately, if they refuse to amend the report, you refuse to give consent. And you can go back to your organisation and say, I want to complain about this occupational health assessment, and I want to have another one, because this was not a positive experience. It was not a supportive experience. But ultimately, if they turn around and say, we're not going to change the report, that's all you can do, refuse to consent to releasing it.
Okay, but that is helpful. And whenever you go to a meeting with the employer, it's really important that you take a union rep there, because sometimes when you're being spoken to by your manager. It's quite a stressful experience for most people, and your rep is not personally invested, so they can listen and they can ask the right questions, and you might miss that because you're feeling nervous and under pressure. So it's really important for people always to have a union rep with them. So we've got another sort of linked question about access to work. Given that it's going to be removed, it's fun. How will departments fund this, basically, is the question. And how is PCS safeguarding this at a DTUS level? So the question says, how will the changes in access to work being funded by departments impact on reasonable adjustments? How is PCS safeguarding this at a DTUS level? And I'm going to bring in Austin Harney. Austin.
Thank you, Jackie. Right, well, you know, this is very devastating, apparently, that they are actually going to cut the access to funding. So far in the civil service itself, in the last decade, we've already had a drastic decline in visually impaired staff, those who are hard of hearing, other physical disabilities as well. Believe it or not, we used to have skillful employees on British Sign Language, you know, who could actually communicate with clients and customers on British Sign Language. And sadly, we don't have them anymore. We seem to be spending money more now on British Sign Language interpreters. But I think that's important, you know, that such people like that should play an active role in the trade union. And I think this is a form of discrimination. It's certainly going to have an impact on recruitment as well for many disabled people trying to apply for work here in the civil service. But you see, existing funding will still exist after April 22, but still it's the future one for future funding. It's appalling. I'm actually very, very angry. I've taken this forward with the Group Executive Committee on Ministry of Justice. I've also taken it forward with the NEC, and we in PCS are going to be expressing our anger at the TUC conference because we put up a motion. It's titled "The Decline of Pay Terms and Conditions for Disabled Workers," and access to funding is one. Work funding is one of them, by the way. So for disabled people. So yeah, I certainly share a lot of people's anger here, and I think we need to campaign very strongly on this.
Okay, so Austin, from that we can take it that the NEC and the TUC, the NEC is on it like a car bonnet, and we will push the TUC. And of course, you have a general seat on the TUC, Disabled Workers TUC, so you'll be there anyway, won't you, Austin?
Yeah, definitely.
Okay, so we'll go back to these questions. I'm conscious of time, and I don't want people to be wearying of these questions, but I think that they're quite pertinent. And this one is quite pertinent given that BEI's policy has just come out. I am very concerned that when I return to work, the office layout will have changed and my reasonable adjustments I had previously in the office are no longer in place. What do I do? That's from Helen Feather in HMCTS. Andy, can you take that question?
It's a worry. It has to be a worry. Again, I'm going to speak very parochially because it's the area I know. Reasonable adjustments still have to be there. Reasonable adjustment passports, Austin's talked about, shouldn't come into this because you're going back into your old job, but are probably very useful to say what was there previously. But with a lot of employers, and MOD is doing this, looking at hybrid working, looking at smarter working, and despite they say it isn't, smarter working always turns into hot desking. This can be a massive worry for people who have special chairs, special desks. One employer area that I deal with in Liverpool came up with the bright idea of having chair parks, so that special chairs can be put to one side and then taken to whichever desk you're going to hot desk to. Well, that's all well and good, but what if you can't push the chair across what if the person has a desk that raises up and down to go with that chair? And they soon realized that they came up with the idea for the best of intentions, but it was unworkable. And what we've agreed in Defence Business Services is that certainly on the return to offices, there will be, for reasonable adjustments, there will be fixed desks that will not be hot deskable, that will be there for the person with the reasonable adjustments so that they're in place. But if they've changed the layout of the office, of course, if you're someone, for instance, with visual impairments, that can be a challenge all of its own. So I would say that in that sort of scenario, that someone from the employer, someone from estate should be there to actually help guide the person in the new layout. I think ultimately, if you're worried, contact your local reps. The BAYS guidance it does translate into employers talk to your local union reps about what you're doing. The local union rep should know what's going on, and they should be able to help and advise you.
Okay, thanks, Andy. And we've got a question. I'm going to give it to you, Austin. What would you suggest as reasonable adjustments for people with learning differences, dyslexia, dyspraxia, dyscalculia, information processing disorder? And that's from Kirsty Hutchinson, who works at some mouthful of an office, which is the Crown Office Procurator Fiscal Services. And I pity anybody that has to go through all of that performance when they say where they work. But Austin, that's the question. What would you suggest? And you're on mute, Austin.
It's my apologies. Yeah. Well, first of all, if you're talking dyspraxia, dyscalculia, the other one was dyslexia. Now, the individual needs, they're not all the same. They vary in each of those conditions. And so the first thing we need to do, well, there is also, first of all, the generic reasonable adjustment plan from the TUC. That's more of a guidance. But some of those, there are people who will need more needs, more special requirements. It depends on what their condition is. And just to give you an example, I'm autistic. Now, I certainly need reasonable adjustments, especially when meeting unrealistic targets and also having to deal with pressure and stress. But other people's needs for reasonable adjustments to those conditions are not the same. For instance, noise, lighting, there are other issues as well, having to try and keep their moods under control. So their needs are quite different from my own. And of course, the same applies to people of those conditions as well. So I have mentioned the reasonable adjustment, generic reasonable adjustment plan from the TUC, but more importantly is OHS referrals. Now, when they go and visit an occupational health specialist, and a referral is not really enough, it would be very helpful for them to disclose their medical files, such disabled people, from their general practitioner, providing they give consent, that the OHS specialist would have a very clear and concise picture. But more to the point is that they should also have an OHS therapist, because I often question how many have visited OHS therapists or been tested by them of people with those conditions. And obviously the answer is no, they haven't, but that is very serious. They have to be tested, and then a proper report needs to go back to management as to what type of job they should do and what their requirements are. So that's something to bear in mind, especially with people of those conditions, and they do vary. So I haven't got the general answer for you, I'm afraid. I apologise for that. But what I've done is I've given you the guidance and what advice to take when one goes to the occupational health referral.
That's really helpful, Austin. And the next question is from Caroline Herbert Carter of Rural Payments. We know where we are with Caroline Herbert Carter. Rural Payments, that seems simple enough. I want to be able to work from home due to my disability, but feel this won't be allowed as they're asking people to go back to work 20% of the time. But I feel unable to do this due to my mental health. Can I be forced to go back if I am contracted to Worcester? Nikki.
Thank you, Jackie. Mandy has also put a comment in that she thinks her team leader and PCS rep have already warned she's unlikely to be successful in asking for remote working from home. It's really important, in addition to the comments that Andy made, it's really important to note that a request for flexible working and a request for reasonable adjustments, you're talking about two separate pieces of legislation there. So you are protected under two separate pieces of legislation. Now, ACAS, if you go onto the ACAS website and look for flexible working request, that will tell you that anybody can make a flexible working request, anybody at all. You don't have to have a disability. You don't have to give the reasons why you want. You might have had a new dog and you want to take the dog for a walk 3 times a day. It really does not matter. What's really important is to understand that flexible working requests, originally it was for childcare responsibilities, then it was opened up for everybody. And you only have to say how it would benefit you to work remotely, how it would benefit the organisation to work remotely. It's really, really difficult for them to turn around and say no to a flexible working request when you've been working 100% from home for the last 18 months. So Mandy was saying she's been told she's unlikely to be successful. They have to reasonably consider this. They can't just say no. They have to give you the reasons why they've said no, and there has to be a discussion. But in any event, if you couch your request both as flexible working request and say why it would be a reasonable adjustment, and a reasonable adjustment, as I said earlier, has to mitigate the impact of the disability. It has to be practical to make. It has to be affordable given the constraints of the organisation, the resources of the organisation. It must not impact on the health and safety of others. If you use the template and apply for working from home, do be cautious about isolation. Do try and keep those regular meetings with the workplace and be aware that your location will remain the same. So if you do go into the office, you'll be paying for your own travel. But other than that, there should be no real problem with making a flexible working request based on reasonable adjustments and getting it agreed. There really should not. But I do think this is something PCS, this has come up a couple of times now in today's conversations. And I think this is something PCS should be picking up centrally, that it's a big concern, not just for people with disabilities, but for everybody.
Okay, thanks for that. And of course, PCS we are PCS, so we are listening. So this one now, this last question, this is the last question of the session. And it's kind of open to everybody, including those who are on the, who are guests here today. So, you know, have a listen to this question and then think about how you would do this, because it's not just for the panel, it's all of you. And you can always, you don't have to come on screen and start answering. What you could do is, if you've got thoughts about this particular question, you could email them in to the Equalities Department, because this question is quite a big question. How do we best recruit members from this community? And by members, we mean union members and this community, the disability committee community, and disability and people who have disabilities. And that came from Rebecca Meaney, who works at National Air Traffic Control Services. So how do we best recruit members from our community? So have a think about that. But I'm going to ask Andy how he thinks we could best recruit PCS union members from the disability committees and the disability community.
So I think the best way of recruiting is through organising, obviously, but it's also showing relevance. And so at a branch level, at a group level, at a national level, to me, and I would say this on disability because it's my hobby horse, and of course there are other strands of equality, but we need to put disability at the heart of our bargaining agendas. We also need to put the other equality strands at the heart of our equality agendas, because we will show to that community that we add value. It's morally, it's the right thing to do. As union reps, it's the right thing to do. Equality is always, in my opinion, been a union matter, but it's having that bargaining agenda, it's getting those successes, it's showing that we have relevance. And Jackie, the thing that we might be poor on, and I'll hold my hand up, I'm blooming poor on this, is publicising those successes. As an individual, I have a tendency to win a battle and move on to the next. And I never think about, maybe I should tell the members we just won that battle. So actually publicising our successes, because we have loads of successes. And even when we don't have successes, learning lessons from how we're dealing with stuff. And I'm sorry, that was a bit muddled of an apple pie, but...
No, I think you're right. We just have to be a little bit careful when we publicise our successes, because sometimes they're subject to confidentiality clauses. But certainly we don't always sing all the good things that we do. And we've got a magazine, Disability Matters. We should be utilising that to publicise some of the work that we do. I'm going to ask Nikki very briefly, do you have any thoughts on how we recruit PCS members from our community?
Well, as Andy said, I totally agree. We don't hear enough good news. We don't hear about the success stories, and those good news stories are going to be absolutely huge in recruiting people with disabilities or without disabilities. I think it's important to use the channels that we've got within departments to communicate with staff, particularly now a lot of us aren't going into office spaces. And we do have the ability, as PCS reps, we can have access to everybody's email addresses. So we can send out newsletters, we can send out material advertising the PCS and saying we're really good. I think a big element of it is that as a person with disabilities, I don't feel really that a lot of people in the PCS, as well as in the workplace, really understand what it's like to have that lack of energy, to have to be fighting the disabilities and the symptoms of the disabilities and work as well. It's exhausting. And I think that if we message that we have got specialist disability reps, and we have got a disability forum or disability fora within PCS, we are probably the largest trade union, certainly in the public sector and the civil service. And I think we should use that to say to people, look, you need a large body of people, together we are stronger. Join the PCS or be in the PCS, make your voice heard. And we have got people that understand what you're going through. We're not all the same, we're very, very different. And the illnesses that I've got, the disabilities I've got, I'll be very different to everybody else who's got those disabilities. But we can all understand what we're going through in trying to get support. And I think it's just messaging people that that support is there and it's available to you.
Okay, thank you. So I'm hoping that you've enjoyed this and you've got something from this. If you do have any thoughts about any of the things that we've touched on today, anything that you think, well, you didn't really answer that in the way that I could understand it, please do email us, because we'll have another go at answering any questions that you think weren't answered to your satisfaction. If you do have ideas about how to recruit, you're knocking on an open door, and we do have various different groups within groups. So In every civil service department, there will be a disability group that you could join. We've got the Disability National Forum, and you can stand as a member if a person from your group hasn't already stood, so there's a gap. But even if they hadn't, we'd love to hear from you. And the way you can engage with us is sending articles for Justice Matters, giving us your life experiences in work so that we can use them in Disability Matters, although obviously we would anonymise them. So there's lots of things that you can do. Recruitment is really important in PCS. And I think that like attracts like. And so if you know that somebody has gone through, might not be, as Nikki says, the same type of disability, because there's so many different types of disabilities. But if you know that there's somebody there who understands how it feels to be treated not in the same way as other people are being treated, you're halfway there to being able to work together to find a solution. And that's what PCS does. We don't want to do it for you, because we can't do it for you, but we can do it together and we can solve things together. So I hope that you will attend some of the other seminars that we've got later. I think there's another one this week and a couple more next week or the week after. So look out for them, and do please engage with us via email if you want to ask any more questions or you weren't entirely satisfied with the answers that we gave, because it is difficult.
I just very quickly come in on a question that was asked by Lynn Farish?
Yes.
She said she's been given designated home worker as a redundancy alternative. Her senior manager ignored the previous application appeals. Her worry is that as this has not been agreed as a reasonable adjustment, it can be removed at a later date. With my HR hat on, if you have got a way of working, even if you've not got a new contract that says you are a home worker, and you can request your a new contract as a designated home worker. But even if you haven't got that, do put something in writing to your line manager saying you recognise you've been given designated home worker status, and that for the future, you will be working remotely, although you appreciate that there may be a need at time to time to go into the local office. There is such a thing as custom and practice. So if you haven't got a contract that says you're entitled to this, that, and the other, but you have been given this, that, and the other for a year, say, or 2 years, that by custom and practice becomes part of your terms and conditions of contract. They can only change your contract by negotiating with you, by consulting with you, or at a push by dismissing you and appointing you on new terms and conditions. But that would be a long, long way down the line. So my advice to you is get it in writing. Even if you are the person that's putting it in writing, get it in writing.
Okay, thanks for that, Nikki. And just to be clear, Nikki is here in her capacity as a PCS rep. So everything she is saying comes from the voice of PCS, because we don't want Nikki's employers going, you said that at a PCS meeting. It's all, it all stems from PCS, and she's speaking on behalf of PCS, but the advice is good. Okay, so we're concluded. We're 10 minutes under time, but thanks very much for devoting some of your evening to this and for engaging in the question and answer sessions, because they're really useful and we will take them away. And if you really want, you can watch the whole process again on YouTube. And you can watch this morning's event on YouTube as well. I think we're getting pretty good now at this. So the second session, I think, but don't tell those who went into the first session, has improved, because our IT, for one, has improved. So hopefully we'll see you soon, and hopefully we will definitely hear from you soon, because we really value your thoughts and ideas. Okay, so have a really good evening and take care, and hopefully we'll see you back for one of the other sessions later in the week.